Welcome to another episode of Health Recoded. I'm Alex, I'm your nurse, and today I'm speaking with Dr. Elliot Justin, CEO of FirmTech, and we talk about sexual health, erectile function and dysfunction, and most importantly, what that means for your cardiovascular health. So, let's dig in.
My daughter has a sign on her desk that says, "If you knew my parents, you'd understand." I don't have a lot of filters, so game on.
I kind of like that though. I think that's where the best conversations come from,
Especially
particularly with health.
or sex. I mean, it's just this. Well, let's get into it.
Yeah, go ahead. How did you first become interested in your field? Like, tell me some about your background.
Well, back then, I'm an emergency medicine physician,
Mm-hmm.
and I practiced for well over 20 years. I estimate I treated about 180,000 people, and that was a really great experience. Uh, and unfortunately, I witnessed the deterioration of healthcare because we went from uh, physician patient focused relationship that was where there's respect to
Yeah.
by the end of my career it was about the electronic health record. And
Mm-hmm.
electronic health record with the best started with the best of intentions to as for patient safety and to improve practice, but ended up just being a billing machine.
Yeah.
So short of a heart attack or a stroke, there are a few emergencies that concern a man as much as a consistently limp penis.
Mm-hmm.
And when Viagra first came out in the 1990s, it was restricted. You could only prescribe 10 pills a month, and those pills had to be prescribed just by a specialist, by a urologist. But meanwhile, pharma bombarding the airwaves, TV, radio, with information about Viagra at that time, back in the 1990s. And men would come into the ER Friday, Saturday night, especially, 1, 2 o'clock in the morning,
Yeah.
wanting their problem fixed.
Yeah.
And of course, for them, it was an emergency. But the urologist, of course, did not regard a guy's anxiety about impotence at 2 o'clock in the morning on Saturday as an emergency. They didn't want to come in. And it became like a running joke. Well, we're just going to get a Viagra beeper. And the urologists have to carry the Viagra beeper on the weekends. I've always been interested in sex.
Uh,
Particularly, I have to say I'm an outlier based on the fact that I don't know any of the doctors whose mothers took them to urologists twice when they were teenagers because she was worried that their masturbation habit might prevent them from getting into college. Here I am, mom, and
oh my god.
I can
So you
remember
had
when
an early start.
and uh, and then what specifically got me into this phase of my career was I live in Montana.
Mm.
And I really enjoy horseback riding. And my wife says I ride like a 12-year-old. I ride at least like with the maturity of a 25-year-old. But sometimes I have the illusion that I'm a centaur, that I'm one with my horse. I'm really having fun, and that can be a dangerous illusion. So some do-gooder had cut a tree that had fallen over a trail in the next valley over. Uh, by the way, it's called Paradise Valley. And don't tell anyone about it. We don't want people coming here to Montana. But someone cut a tree that had fallen over a trail, so you could walk underneath it, but you couldn't ride a horse underneath it.
Mm.
And I was moving along really fast and was not paying enough attention, but also was looking off in different directions. So I broke 6 ribs and 6 vertebrae,
Mm.
and that got me interested in what's been done to rehabilitate sexual function in men and women who had a spinal cord injury.
Yeah.
I fortunately did not have a spinal cord injury, and there were, as I recall, 6 papers in the urology literature, peer-reviewed papers, uh, that claimed that they were able to neuromodulate human sexuality. So when we talk about neuromodulation, the paradigm is really cardiac pacemaking. Most people know about
Mm.
cardiac pacemaking. Putting an electrode in the heart, we can even make the heart beat after you're dead. We're controlling nerve function. Uh, so to be able to neuromodulate human sexuality would be really powerful, not just if people want to optimize their performance, but for an aging population with more and more sexual problems, that would be really powerful. Uh, and so in these papers, they placed an electrode by the pudendal and cavernous nerves, everyone's two favorite nerves no one talks about, that come out from underneath the pubic bone, that are responsible in men and women for arousal and
Mm.
climax.
Mm-hmm.
Uh, and I tried out on 2 rams, 2 male sheep,
Oh.
and we got erection, ejaculation, but we also got defecation, urination. So it wasn't quite bedroom
Mm.
friendly.
Yeah.
And I basically had a choice that I could raise a bunch of money and go down to Nigeria, the Congo, and try this out on men with ED, or I could just try it out on myself. So I had a friend of mine, a urologist, who has a clinic, surgery center in California, went to his clinic,
Mm-hmm.
had him implant electrodes by my pudendal cavernous nerves, tried all different amplitudes and frequencies and voltages, and I never felt anything more than the tingle from the electricity. I actually don't think we understand the neurophysiology of human sexuality.
Yeah, I
And if my
agree.
wife were in the room, she'd say it's Aphrodite. Well, I can go with that one for the time being, because in the end, I think we will figure it out.
Yeah,
I think it's more complex than just the nerves.
yeah.
Um, so the and which is interesting because obviously I think there are obviously higher cortical functions and that are involved that we just haven't mapped
Mm-hmm.
to figure out. Anyway, I called up this test on myself Project O, and tried to get it published as a case report, but couldn't. Uh, but it was a good story.
Yeah.
So I was working with with a surgery professor at the University of Utah on a catheter to regulate blood pressure after stroke. The surgeon told the story to a professor of urology. It's about 4 years ago,
Yeah.
and he said, "Oh, I want to work with him because I've been trying for the last 9 years to come up with a way of counting the number of nocturnal erections that men have."
Okay.
So he contacted me, and I said, "Why do we care about nocturnal erections? We know about morning wood. We laugh about it."
Uh-huh.
He said, "Because nocturnal erections are a leading indicator of a man's cardiovascular and sexual health. The penis, the canary, and the coal mine of cardiovascular disease." And I never heard that before,
Yeah.
and that took me aback because at that time, and I want to add that at that time in my career, I had become a consultant with remote patient management sensor technologies because I also got involved in the telehealth company
Mm.
who I founded called Swift MD, and that telehealth company had a wing called Swift Vitals where we were way before our time. This would be back in 2006, 2007.
Okay.
We wanted to get the vital signs off of the wrist, off the old radial artery, ulnar artery, and we got pulse and pulse oximetry in a band,
Mm-hmm.
but I couldn't raise any more money. Today, you got Whoop, you got Apple, you got
Yeah.
Garmin, you got all these wearables that are getting vital signs off of the finger or the wrist. But I just too far ahead of my time,
Yeah.
and there was at that time it was no, you need to go see the doctor in order to get your problem solved. Yeah, doctor has to examine you, and suddenly after COVID, oh, you don't have to go to the doctor at all. Matter of fact,
Mm-hmm.
you can fill out a questionnaire and get a pill.
Mm-hmm.
You can go to a telehealth service and speak to a nurse or nurse practitioner, and and not even a doctor, and they'll diagnose and treat you over the phone. So things have changed, but it got me interested in remote patient management technologies. Um, what type of information can people get at home that will hopefully prevent them from having to see a doctor because of the getting preventive health information?
Yeah.
If you have a problem, they'll help to guide them to deal with that problem intelligently and cost effectively. So this urology professor wanted to come up with a way of counting nocturnal erections. He told me that this is a leading indicator of man's cardiovascular and sexual health. And when I heard the word leading indicator, it kind of lit up my brain
Mm.
because in medicine, we don't have a lot of leading indicators.
Yeah.
In medicine, we treat associations and
Mm.
often too aggressively
Yeah.
with blood pressure and low proteins jumping out immediately. Yes, blood pressure and low proteins are predictive at the extremes, but we treat people in the low high range and very aggressively, and that's not really predictive in those ranges. For example, my blood pressure goes from 120 to 140. Maybe it's a signal of something. If
Mm.
my blood pressure went to 220, I got a problem,
Yeah.
and that's an emergency. Um, but if the man's number of nocturnal erections comes down in number by 50%, the man has close to 50, in most studies, has close to 50% chance of having a cardiovascular problem in the next 2 or 3 years. In some studies, it's as high as 70%. Well, that's really interesting because we there aren't a lot of vital signs that are going to motivate a man to improve his overall health.
Yeah.
Uh, Guys are a lot more interested in their sexual health than they are in how many steps it took yesterday,
Mm-hmm.
or some heart rate variability thing that Aura comes up with that says, "Oh, you're maybe under stress." So, uh, we live in this incredible age of healthcare wearables that with the promise that we're going to get individualized care from these things, as opposed to one size fits all care that we doctors make mistakes with all the time.
Mm-hmm.
And we're all on the road, men and women too, from sexual and cardiovascular fitness to sexual and cardiovascular dysfunction. And we all would like to get early signals about
Mm.
those problems before they become overt. You don't want to find out that you have an abnormal electrocardiogram after you have chest pain. You want to get a signal, before you have an abnormal, electrocardiogram.
Yeah.
So um, this doctor at the University of Utah, um, unlike me, he's what I call a cock ring virgin. I'm
Mm.
married for the last 38 years to a woman who's interested in, enjoys sex toys.
Mm.
And most straight men are not interested in cock rings. 90% of gay men use cock rings regularly. Only 10% of straight men use them regularly.
Mm.
And there's a reason for that. One, they're obviously more into it. But two, the rings are uncomfortable. They're these hard silicone rings. They pinch, they're uncomfortable. In order for them to be effective, a man has to have a full erection. And then you slide this ring down the shaft of the penis, and it goes around the base of the penis. And it's cutting off the blood flow and keeping the blood in the penis. And, essentially you're lynching your
Oh.
penis. And they're not
Yeah.
really, they're safe to be used more than 20, 30 minutes. And there's a reason why they've not caught on. So when he told me he wanted to count the number of nocturnal erections, my thought was, well, I want to embed sensors, and I'm not going to call it an erection ring because cock ring
Mm-hmm.
puts the realm of a sex toy novelty.
Yeah.
I want to come up with I have to come up with an erection ring that can be worn for a lot longer than 20, 30 minutes. That can be worn for 8, 10, 12 hours while someone's
Mm-hmm.
asleep. And the idea for it came to me when I was scratching my wife's back. Because I had estimate, I'm talking to men and women now, that that could be the majority of heterosexual sex in a committed relationship starts when the woman wants her back scratched when the bra comes off. Right? Yeah, you laugh because you like your back is itchy. Why is that? It's because the way there's a silicone panel in the back of the bra,
Uh-huh.
and the silicone is irritating to the skin. And over time, if the fashion industry data says that women adjust their bras about 10 times a day. You're not
I'm
even aware
surprised
of it.
not more.
Yeah, this is study, average,
Mm-hmm.
because people, I wasn't thinking about that, but now, of course, I'm more aware of it. And now I also became aware of the fact that, oh, I adjust the waistband of my underwear several times a day. Uh, well, why is that? Because the waistband of men's underwear is made out of silicone, and it's irritating. And some are, especially on a hot day, or if you've been working out, or it might fold on itself, or it pulls on whatever. It's irritating. Not going to say it's painful, but but it's annoying. But we forget about it because we wear these underwear. We wear them all the time. We just forget about it. So my thought when I was scratching her back. I looked down on the ground and I saw her bra, and I said,
Uh-huh.
a bra is a ring. Women don't put on bras over their head. A bra opens and closes with this feature, a hook.
Oh.
And I thought, why don't we make an erection ring that opens and closes with a hook? Because it'd be easy on, easy off, it'd be safe.
Yeah.
And then on her desk, my wife had a stress ball, soft, squishy stress balls. And I said, oh, duh. Why are we making erection rings out of hard silicone? Why don't we make an erection ring out of elastomer? Stress balls made out of elastomer. It's softer. It's stretchier.
Mm-hmm.
Elastomers have silicone makes us adapt to them. Hence, you know, the mark that a bra that's a little bit too tight can leave on your skin, or the mark that underwear can leave on your waist, or the sock worn if you wear socks all day, you might get a little indentation or mark in your sock. Silicones make us adapt to them. Elastomers
Adapt to
adapt to
us.
us. It's different. It's different property. So let's make an erection ring out of elastomer. So it can be worn for hours. It doesn't block the arterial flow and opens and closes with a hook because we want the arterial blood to flow in because we want to measure nocturnal erections.
Mm-hmm.
So imagine the force is still on, blood is still flowing into the penis, but you plugged it on the other end, say 75%, to constrain the venous return. And if you're not erect, there's no constraint whatsoever. There's no constraint whatsoever. So now we have a ring that can be worn overnight. There are two sensors embedded in the ring. There's a pressure sensor there. You can see the button.
Mm-hmm.
In the hook, there's a strain gauge. As the penis expands in girth, it presses on the pressure sensor. It pulls on the hook. It gives the computer two data points that the computer then can interpret, turn to a 1 to 10 firmness scale. And so that's the backstory.
That's the backstory. Wow. I have so many questions from all of that.
Sure.
So this is not specifically a sex toy. This is more of like a Whoop or an Aura ring for nocturnal erections for people to, or men to understand any underlying conditions that may be occurring.
Underlying conditions, medications, relationship issues. Yeah. The
Oh,
device basically, fundamentally, we have to call it diagnostic aid. We can't say it's a diagnostic. That's a legal thing, but
yeah.
it's a, I believe it's
Yeah.
a diagnostic. But it, one overnight, it counts the number of nocturnal erections, measure the duration of firmness. A deterioration in those numbers is an indicator of a cardiovascular problem or a medication
Mm-hmm.
problem, usually. Because at night, when you're sleeping, then there are no variables. You're not with a partner. You're not masturbating. We eliminate variables. Um, but it can be one during sex as well too, to measure duration of firmness, which men are
Mm-hmm.
interested in,
Mm-hmm.
and it also functions as an erection ring because it will optimize a man's performance. So I got into this for the data,
Mm-hmm.
Alex, and we've had 3 men get cardiac catheterizations because the data was so lousy, and
Wow.
we documented 270,000 erections,
Wow.
about 90% of which are nocturnal sessions, overnight sessions.
Mm-hmm.
This is the world's largest dick database,
Yeah.
and it overturns the conventional wisdom about men's sexual health. We
Mm-hmm.
have the conventional wisdom is just frankly absolutely wrong about what's going on with men, because the studies that were done in the past rep are were limited in numbers. No one has a data set this large,
Mm-hmm.
and they didn't really. One of the mistakes that we make in medicine is we doctors, academics who set the standards, they see the sickest people in the practices
Mm-hmm.
and they project from them on the general population. So the urologists are seeing men who can't get up or struggle to get it up, and most of those men have cardiovascular or diabetic problems, but that's not most men. So the
Yeah.
current thinking is that um, cardiovascular or metabolic diabetic problems are responsible for about 50 to 70% of erectile dysfunction. It's not true. Here's what the data shows. So the expectation was that the conventional wisdom is that the incidence of erectile dysfunction goes up 10% per decade after age 40. By my age, I'm 73, it's 70%. And therefore, men, as they age, get more diabetes, hypertension, atherosclerosis, take more medicines. As they age, their erections, sex erections should become less firm.
Uh-huh.
The nocturnal erections should not last as long, should become less firm and go down in number. Didn't happen. So why is that not happening? And I think it's because why are men, the vast majority of men
Mm-hmm.
in their 70s, just as hard as men in their 30s? Well, it's because the definition of erectile dysfunction is flawed, and I'm on a crusade. Not crusade is a famous word, but I'm on track to change that because of all the research being conducted with our technology. So here's the definition of erectile dysfunction.
Mm-hmm.
First clause: inability to get an erection or difficulty getting an erection, and decreased nocturnal erections. Well, those guys have a cardiovascular problem, but it's only 3 to 5% of men who have that problem in our largest data set in the world, and that's a real problem.
Yeah.
Our device is really valuable for identifying men with that problem. The second clause of the official definition from the International Society for Sexual Medicine is difficulty sustaining an erection, maintaining an erection. Well, it's all men. That's all men as we get older. Uh, the expectation that a guy who's 60 is going to perform like a guy who's 20 is just stupid. So what's going on for guys losing their erection? Well, it's multifactorial. It could be there's a baby crying next room. You're worried about paying the mortgage. You and your wife or partner aren't getting along. You've had 4 cocktails. Maybe it's 1 o'clock in the morning and dancing hard for the last hour was a mistake. Or it could be, in many cases, and doctors don't want to talk about this, we prescribe medications to men that interfere with their sexual health and don't
Mm-hmm.
warn them about it. The SSRI and depressants are a disaster for
Yeah.
men's sexual performance. Uh, the um, the many antihypertensives are problematic, uh, and if you and doctors don't even think about it because hey, what sex isn't important, but also because sex is not an electronic health record. Doctors could make money asking questions about sex. They would. People want to talk about how it's a cultural thing. We're just inhibited. We don't want to talk about sex. We doctors talk about vomit, shit, diarrhea, piss, pus, but we're not inhibited at all when it comes to talking about this disgusting things. And sex, nobody
Hmm.
thinks that sex is disgusting. It's intimate, but all those
Hmm.
other things I just mentioned are intimate as well too.
Yeah.
Hey, hey, Alex, how's that pus smelling coming from your pilonal abscess? Just to pick on you for a moment. It's we. So I don't buy the cultural thing.
Yeah.
I, I I think it's a failure. I think the fundamental problem is that doctors can't make money off it. There's no box
Mm.
to check. Hey, ask questions about someone's sexual performance, and you'll make another one. Make it up for the family doctor at $25. Nor
Yeah.
is there a box to check for the urologist because to make money because the urologists are focused on surgeries. That's and radiation therapy, and so
Hmm.
that's how they make money. So, second clause,
Hmm.
difficulty, maintaining erection. Uh, what's going on at the basic physiological level? Guy's getting hard. Doesn't his problem's not getting blood in? His problem is not with his heart pumping blood. His problem is not with his arteries. Blood's leaving the penis. There's no pill that will prevent the blood from leaving the penis.
Yeah.
Only a ring will do that. And I didn't understand this 4 years ago. 4 years ago, I was like most men. If you asked me about erection rings, I would have said, "Hey, I'm good. I don't need it.
Yeah.
I might play around with it, but I don't need it." And now I realize it's not about good. It's about all men. Men with ED, men without ED will benefit from erection rings. And why is that? Because only a ring will hold blood in. So if a man wants, here's a question every man and every woman or man who's involved with a man should
Hmm.
ask themselves: do you want to get harder than you can right now? Beyond rock hard, there's erection ring hard. Do you want that? So, of course, every person should want that. Every guy will
Yeah.
say yes to that. Now, the average man using our device in a study of it was like 30 men increases his girth by 3 millimeters by using an erection ring. Well, that's not very much, but it actually is very much because three, no one's gonna walk by and say, porn star, 3 millimeters. But no, but the that's more blood than you can hold in the penis with a hand, a mouth, vagina, etc.
Hmm.
The more blood you hold in the penis, the longer you're gonna last, the more sensitive you're gonna be because the more blood you hold, the more sensitive you are. Women use vibrators, so they don't have this issue. The
Hmm.
vibrator maintains continuous arterial blood flow, and also the vibrator also helps to retain blood in the bulbs of the clitoris. Men don't have that. Blood goes
Hmm.
in, blood leaves. The PD5 medications that are so popular, Viagra, Cialis, they put a little more blood in. They're helpful, but they don't keep it there.
Yeah.
So here are the questions guys should ask themselves: Do you want to get harder? Of course. Do you want to last longer? Of course. Do you want to be more confident? Meaning, hey, have that third cocktail,
Mm.
or stay up another hour because so often people they have confidence issues. Another important one that and I've heard about this from several women of customers. I heard from my wife as well too. Is she likes the fact that she's more confident in me. She
Mm.
likes the fact that with a ring on, he's going to stay hard for 40, 45 minutes of minimal stimulation. Now, what does that mean for her? Well, most women involved with men in a committed relationship care about the men. So what are they
Yeah.
thinking about? So in a healthy relationship, and I hope this isn't too graphic, a healthy relationship, the woman usually comes first, and the woman usually comes first from oral sex, and we end up with a
Mm.
vibrator.
Hmm.
And then what happens? Well, while she's focusing on her pleasure, if she cares about her man, she's also thinking, is he going to be hard afterwards?
Hmm.
Am I taking too long? And these just common questions that the women ask themselves. Well, those questions go away when a guy has a ring on because he's hard. And a man who's worried about losing his erection is probably going to lose his erection. A man who's not worried about losing his erection because he has a ring on, he's still in the game because that's the male
Hmm.
mindset. The and and the last question is, do you want to have a more intense orgasm? Only a ring will give a man a more intense orgasm. How? Because we're putting a bit of light pressure over the urethra and drawing out the ejaculatory phase. The rings are designed to draw out the ejaculatory phase, and the longer the ejaculatory phase, the more intense the orgasm. So my ejaculatory phase time with our device goes from 4 seconds to 7 seconds.
Mm.
Well, that's an incredible orgasm. I first had it when I was age 70. I didn't have before then. Well, what does my wife like about that? I love it. But what am I like about it? She likes the fact that, wow, it's more, whatever she's doing to me now becomes more intense as well too.
Mm-hmm.
And not just picking on my wife. We hear about that from my customers all frequently. So all
Yeah.
men. I got into this with the data. The data is really important. Every man should know what the vital signs are of his sexual and cardiovascular health by monitoring his nocturnal erections. Just the way, especially every man over the age of 45, 50. If I went to a doctor right now
Mm-hmm.
and he just said, "Hey, Elliot, you look great. What are you doing here?" I would think, "Is this 1900? I can get an electrocardiogram, check my low proteins, and they're probably all going to come back normal,
Mm-hmm.
and that's nice. I feel good. I don't feel I've wasted my time because my diagnostic and blood tests are normal. I feel, oh, that's great. I feel better about myself, but I do want to track them because I'm looking for early signals of problems, and it's the same thing with the data from our device. I'm confident that what we're doing will become embedded in clinical workflows. It'll take 3 to 5 years, Alex. You know how
Yeah.
slow things are in medicine, but it'll become embedded because it's an easy. And I'll share with you that right now there are two large studies going on. One's at Brown University and Cleveland Clinic, and the others at Baylor and a hospital in Madrid, Spain. But they're looking at the correlating nocturnal erection parameters with CT calcium scores. CT calcium scores will become, as you know, the screening test for cardiovascular disease in men and women, and along with other inflammatory markers, ApoB and other inflammatory markers of cardiovascular health. And I'm confident those papers will show that the value of our device is, as complementary to them. There's already a paper at the University of Utah showing that our device is as good as an in-office Doppler, which
Oh.
for screening for men's sexual health. And I think our device can probably better because
Yeah.
the in-office Doppler is one data point. Our
Mm-hmm.
device, a man gets multiple data points. And I know from my data, it can be variable depending upon sleep, alcohol, other factors. So here we have these guys who are going to
Mm-hmm.
benefit from a ring, who think they have ED, but that's not really ED to my mind. I'll put it this way, Alex. I won't ask how old you are, Alex, but I'll ask this question:
Uh-huh.
Do you run as fast now as you did when you were 16 years old?
I don't run, but I'm just gonna say no.
Yeah. Well, almost no one does, even people who train. Well, the answer is, Alex, I think you have a bad case of RD, running dysfunction.
Mm-hmm.
And I can help you, Alex, before it gets worse. You don't want to end up like me, Alex, with a really terminal case of running dysfunction. I have a whole series of exercises, supplements, pills, and I have to start seeing you now at least every quarter. But that's what we've done with men with erectile dysfunction. We have millions and millions and millions of men identifying as having erectile dysfunction when what they really, because we've medicalized the aging process, what they
Mm-hmm.
really have is erectile disappointment. So, and let me nail this down with an analogy. Uh, if I fly to visit my grandkids and they're in Sweden, some of my grandkids are in Sweden, and I sit on a plane for 12 to 15 hours, my
Uh-huh.
rings get tight
Mm-hmm.
and my socks get tight. And why is that? Because it didn't happen when I was 25 years old. Why is that? Because as we get older, our venules, our small veins, get stiffer, and the smooth muscles around our venules that squeeze the blood back to our heart, they get weaker with age. You think that's not going on in the penis? So what happens in the penis? As we get older, blood leads faster because our smooth muscle and our venules get weaker. When a guy's, yeah, I'll pick on myself. I'm 13 years old. I can remember her name too, Susan Tannenbaum, in my sixth grade class. She held my hand for 5 minutes. I had a hard on for like 2 hours uh, without any other stimulation. That doesn't happen to me anymore. And
Yeah.
some people want to say, "Oh, it doesn't happen anymore because you are you're jaded basically." But no, my thoughts are much more sexually explicit now. basically because I have so much experience, than they
Yeah.
are then. It's just we are younger then, and obviously
Hmm.
there are hormonal issues that enter into this as well too. But the doctors have overlooked the aging of the venous side of the circulation, and the ring addresses it.
So you're saying that because I've learned that around age 40 is kind of the expectation to see the decline of erectile function. Are you saying that's not really the expectation, that if that occurs, there's
It happens earlier.
other.
It's happening earlier. The decline in men's sexual, well, two things.
Uh,
One, men. There are two aspects to this. Men, in a large data set, men in their 70s are just as hard as men in their 30s. But men in the 70s are saying they have ED, and they're saying that in a great number because they don't have ED. Their just erections are going down faster for a variety of reasons. But they're just as hard. Vast majority, not guys obviously with severe hypertension, diabetes, are a different category. Here's what male deterioration happens even earlier than female sexual health deterioration. So a young man who's 15 can masturbate 7 or 8 times in a day.
mhm.
A young man who's 25, maybe he's down to 4 or 5 times a day. A guy who's 35, he's down to 3 or 4 times a day. And the interval between climaxes gets longer and longer and longer. So the deterioration in men's sexual response is the deterioration in the refractory period, the time between climaxes. Women don't have that issue
Yeah.
to the same degree that men do.
So then erectile dysfunction with aging, at least, is not so much not being able to get hard, it's just a slight change in the length of duration, is what you're saying, and how long it lasts,
It,
unrelated to PE.
it's a decrease. The erection goes down faster.
Yeah.
Here's a study. This is blended data from two studies. We
Mhm.
looked at we not we. When I say we, I mean research using our device. Uh, she looked at D2 messenger time, the time it takes for an erection to go down after climax.
Mhm.
I don't think it's been studied ever. Um, and it was about 35 men aged 28 to 70, and these were men who didn't have ED. And I'll tell you about the men with ED study afterwards. These men without ED, um, and basically, and the study was like, hey, masturbate because we don't want any other variables. Avoid alcohol, avoid marijuana, just masturbate. Uh, get rock hard, have an orgasm. How long it takes the erection to go down? With nothing, it was like 30 seconds. With tadalafil, 10 milligrams, most commonly prescribed erection pill, it was 2 minutes. So holding more blood in the penis, which is good.
Mm. Yeah.
With the ring, it was over 3 minutes,
Mm.
and with both together, it was over 4 minutes. And the takeaway for that for all men is, you want to optimize your performance, put a ring on it, and then take a pill.
Mhm.
There's a Dr. Yoshi Sato in Japan who did a study of the ring alone. We make rings without technology, called performance ring. He
Mhm.
did a study on 40 men with really D. By really D, I mean, my perspective, my
Mhm.
definition. Really D meaning struggle to get it up, struggle to maintain an erection, an inability to have an erection and sustain it for satisfactory intercourse, get hard enough.
Mhm.
Uh, and there's something called erectile hardness score, EHS. It's a 4-point score. A 4 is normal. A 0 is a totally dead penis. Uh, and a 2 can stiffen but can't penetrate. A 3 is stiffen, can't penetrate, but lose it, cannot have satisfactory intercourse.
Hmm.
All the men were taking either Viagra, either sildenafil or tadalafil.
Mhm.
In the EHS2 category, these are the guys who couldn't even penetrate. They got a little stiff,
Yeah.
they couldn't penetrate. 50% of the men, if they added a ring, were able to have satisfactory intercourse for 10 minutes. In the EHS3 category, and this is the vast majority of men who have significant ED. These are men who could stiffen but couldn't sustain their erection for a satisfactory period. 100% of them were able to have intercourse for 10 minutes, and the vast majority stayed hard for 8 minutes after they climaxed. Now the numbers are small. It was 20. It was 20 men in each group, but
Yeah.
that shows that the power of the ring, even with men who have, from my perspective, genuine ED, they're not getting enough blood in.
So is this ring that you're referencing from these studies the tech ring you're talking about, or the other original cock ring that you're talking about?
Well, we have three rings. So
Okay.
the Japanese study was with the ring without technology, with the performance ring. The D2 Messon study was with the tech ring.
Mm-hmm.
And men were encouraged. The tech ring is adjustable, the tightness.
Mm-hmm.
Men were encouraged to adjust it to what their
They
degree of
needed.
comfort that they comfort and performance that they wanted.
Mm-hmm.
Um, the big data study of 27,000 erections. Well, that's the tech ring. That because you can't get data without the tech ring.
Yeah. So you originally started studying for the neurological issues, correct? But then transitioned
Heart
to the
issue.
vascular?
We just got involved in this for the heart issues. Um, to look at nocturnal erections as a marker of cardiovascular health, and then realized that I come up with a performance optimizer for men. I mean, look at. I mean, men have nothing.
Yeah.
Telling me stupid strokers, that's something you can beat someone to death with. Women have so much. I mean, women often complain, probably so, that they're not studied enough.
Mm-hmm.
But when it comes to sexual optimizers, it's unbelievable. I think my wife could come to bed with a bandolier, depending upon because she's open minded. So what shape,
Mm-hmm.
what form, what sensation do I want? This type of vibration, that type. It's extraordinary that what women have available to them if they're open minded.
Yeah.
Now, back and that's occurred. I'm a lot older than you. My mother's vibrator in the early '60s was huge, but it was also stuffed away in a bottom drawer in the supply closet.
Mm-hmm.
When I was most actively dating in the late '70s, early '80s, that was when men, not women, this was kind of amusing, men, not women, that decided to commercialize the vibrator. The vibrator's been around since the 1860s, 1870s. And the original vibrators were steam powered. The and you can find these ads in women's magazines from like the 1880s and 90s, for hey, for women's problems, put this on your stove, but originally the concern with vibrators was that, it's like the end of the American family. Women are going to marry the vibrator, or that they're going to be numbing and they're unnatural. And
Mm-hmm.
now they're normalized. I mean, my wife,
Mm-hmm.
like many women, can climax without a vibrator, but she prefers it. Why? Because it's better. The more variety of sensation. Well, what I don't. As I said 4 years ago, my attitude towards erection rings was, it's stupid. I don't need it. I'm good. Now
Mm-hmm.
my attitude is, I don't have an orgasm without it because it's always better. Why would I want to have an orgasm that's not as good? And my wife's idea of foreplay is, because I'm a guy, hey, here's a ring. I'm like, okay, I guess I'll stop working.
Yeah.
So I think the men and doctors
Mm-hmm.
need to open their minds about erection rings. And one's obviously for the data,
Mm-hmm.
and I don't want to minimize that. The data is profoundly valuable. The data will tell you about your sexual and cardiovascular health, and all men should want to know about that, not guess, not
Mm-hmm.
think. Because we have a saying in emergency medicine: eat right, stay fit, die anyway. We all would like to get signals early on about problems from wearables, whether it's
Mm-hmm.
a ring or whether it's Whoop or a Garmin or our device. We want to get signals early. So with I've had a couple of men tell me just in the last month, I wish I'd gotten this earlier or known about it earlier, because these guys had bad data,
Yeah.
and they're right, but it is new. And then of course at the other extreme, there are the guys who say, I spend $275 and my data is normal. Why do I spend this money? Well,
It's still good data.
look at data. I know, go tell your blood pressure cuff that. Go tell. It's like it's those stats, these people. But the data is really valuable. But I did
Mm-hmm.
I got into it for the data, but then I realized I've actually come up with a way of optimizing men's sexual performance.
Yeah. I think it's very important data to know as well. So you talked about what the ring is showing us, but what does erectile health actually tell us about vascular health?
Well, if you're in good erectile health, you're more
Mm-hmm.
than likely not to be in good vascular health. I can't tell you the percentage correlation.
Okay.
I'm guessing it's going to be high,
Mm.
and I can tell you that our device also functions as a sleep monitor, but I can't. I shouldn't tell you that, but I know it does. Um, so actually I did a podcast a couple of weeks ago with someone about wearables,
Uh-huh.
and the guy said that he's impressed by the fact that Aura correlates 79% with the data from a sleep lab.
Hmm.
Well, he was unaware that's actually bad. That, that because in medicine we're looking for 95% correlation, not 79%.
Yeah.
Um, but I know there's a study right now going on at Baylor University comparing our ring to Whoop
Mhm.
overnight, and our device correlates 100%, with Whoop,
Wow.
and that's interesting. So I'm actually I have a call later on today with a sleep doctor who's interested in doing a study, and that would be
Yeah.
really valuable to people. So I think there's other information to get out of the device. I just can't make strong claims because we don't have the data. But I
Yeah.
do know that your sexual health is a leading indicator of your cardiovascular health. Um, and as to the percentage, I can say if you have bad ED data, it's close to the correlation is close to 100%. If you have good ED data, it doesn't mean you don't have a heart problem. That's I don't 'cause so that's the difference.
Yeah. So at what point is if somebody were having these erectile difficulties that you're talking about where they're not having the erection for as long, right? So the blood flow is leaving. How much of that do we absolutely know is vascular and how much of erectile dysfunction issues are more of a neurological or a psychological problem or another comorbidity?
Okay, that's a great question. So, um, and here's what we know, and here's what we don't know.
Mhm.
So, I am, the current thinking is that erectile dysfunction is um, that approximately 50 to 7% of the men who have erectile dysfunction have a cardiovascular problem. I know that that's not the case. Doctors
Mhm.
don't know that yet because the big data study that we have, that I can tell you about the data, it hasn't been publicized yet, but it's there. So what the actual problem is that it's only 3 to 5%, maybe 5% tops of men who are currently diagnosed having erectile dysfunction actually have a cardiovascular problem. And that's because we've grouped together these two categories of men that don't belong together: men who can't get it up, and men who get it up and lose it. Um,
Mm.
so that's the big number. The We do know that that the antihypertensives and depressants have a negative impact upon cardiovascular upon sexual health, but we don't. It's dose and individual related. That's where the device is really valuable because there are guys out there who can pop SSRIs and take beta blockers, and their dick continues to function really well. And then there are guys out there who start taking those pills, and their erections go from a 10 hardness to a 7 hardness. And the nocturnal erection duration goes from 45 minutes on average to 20 minutes on average. So that's the power of the device because it allows people to assess their own sexual and cardiovascular health objectively.
Mhm.
The There are, but I do want to say that there are men obviously who have good erectile per, per, nocturnal erection parameters who do have a heart problem. Uh, but we also know that at the same time that if those numbers go down, you got a heart problem. But now the device is telling you have a heart problem. It's not. It looks. It's like your blood pressure cuff.
Mhm.
You can have normal blood pressure, still have a heart attack. That's just you can have normal ApoB, normal lipoproteins, normal electrocardiogram, and even get a normal stress test. I mean, and still have a heart attack. But that doesn't mean you shouldn't get these screening tests because we're looking for signals in the screening test. They're just not 100% predictive.
Yeah. This is also fascinating. I have so many more questions I want to ask you, but I know we're getting closer to our time.
Yeah,
Um,
I got 5 more
so
minutes.
Okay. Well, what is one thing you want listeners to take away as we wrap up?
Here, I'm going to give you three things, okay?
Okay.
The first is we are developing, this year, the Clitique, the world's first modern health for clitoris. We're going to
Oh.
deliver to women commercially certainly by March of next year, the ability to have a smart wearable that goes in and out of the vagina, one overnight, one during sex, which they'll be able to measure the impact of diabetes, hypertension, atherosclerosis, medications, and women take what medications that men do upon their sexual health. Women, postmenopausal women, will be able to optimize their HRT and their testosterone because they'll
Wow.
see. What's the goal? One of the goals is women want to be wet and they want to be more responsive as they go through menopause. Well, right now your hormones are being prescribed on a generalized one size fits all basis and come back in 3 to 6 months. Now you'll be able to
Mm-hmm.
do what men can do, which is this dose is not working for me. You'll see it right away because you're not going to see the blood flow in the clitoris. So that's coming. But the other two things are, if you're a man over the age of 45 or 50, you should get your sexual health data. You should put a ring on it and get your data. You're going to want it as a baseline, uh, if it's normal. And if it's abnormal, it'd be nice to find out when you're 45 rather than have a heart attack when you're 55.
Mm-hmm.
And the third thing is, all men, whether you have ED or don't have ED, you can optimize your performance and your pleasure and your partner's pleasure with an erection ring.
So don't be afraid of them.
Don't be afraid of them. Yeah, good point. And women
Yeah.
need encouragement to use them. I mean, part of the problem is, I'm talking to men, a lot of men, and post customer services, men are embarrassed. Women today are not embarrassed to use a vibrator.
Mm-hmm.
Maybe on the first date, but they're not embarrassed to use the vibrator. They're just normative. And I know my daughter's generation, that when she's 30, before she got married, she'd take them on dates. It's just they're just in her group. They're just normalized.
Yeah.
And men need to up their minds about rings, but women need to as well too. I mean, you want your guy to perform, put a ring on him. Foreplay.
Might as well. Why not? Well, I've really enjoyed this. Where can the audience find you?
Sure. You can find us at myfirmtech, myfirmtch.com. You can click on the science section, go click on research, and you can see all the research that's being done with the technology. You can reach me personally at Elliot, ELLIOT, at myfirmtech.com.
Okay. Thank you
And
so much.
Instagram, myfirmtech.
It's a what?
We're on Instagram too, myfirmtech,
Oh,
and
okay.
LinkedIn.
Yeah. I'll link everything in the description on YouTube as well.
Excellent.
Yeah. Thank you so much for listening. I hope you enjoyed this conversation. If you found it helpful, please like and subscribe or share it with someone else who might find it interesting. You can always reach out to me, leave a comment, or find me on Instagram at Health Recoded Podcast if you have any questions or any topics that you want covered. Thanks for listening, and I'll see you guys next week.